This is Dr. Saab. Today I'm going to show you a short video on controlled substances and how to proceed to prescribe a controlled substance for a patient. As you know, Nevada has some recent laws that indicate that we need to determine the risk for assessment, for the risk for abuse for the patient before we prescribe a controlled substance. Okay, so we're going to start by producing an order group, and we're going to move over the problem of chronic pain syndrome. And we need to create some templates that are designed to help us out with prescribing controlled substances. The first one is called pain medicine. And it's a point-of-care test like all the other templates. The second one is called medication management. And here it is. It's called medication management referral. It's also a point-of-care template. And we're going to see now how to use those two templates. So the first thing we need to do before we prescribe a medication is we need to make sure that we meet all the criteria for the prescription. And this is a checklist that helps us do that. So the first question it has is this initial prescription for the controlled substance? And you can choose yes. And initial urine drug screen, we need to order it today. We'll order it. Supposedly it was ordered previously, but if we get a short-term prescription, no more than 2 weeks, it's okay to go ahead and order it and then check on it and go from there. Preferably you would need to do the urine drug screen before you prescribe the controlled substance. And then you need to do a PMP on the patient. And your initial prescription should be for no more than 14 days. And it shouldn't be more than 50 morphine equivalent. And the ICD-10 for the disease being treated should be written on the controlled substance prescription. And you say yes. And it should be in the medical record and the prescription. And prescription should be for the fewest number of days. And you should have an informed consent, which is in Appendix B, and I'll show you now how to get that. And the next items are the prescription for longer than 14 days, so they don't apply to our patient, so we can leave those blank. Since we answered yes for our checklist, we can proceed to the next step. And the next step would be to fill the next template, which is pain medicine, and that will show us the risk for abuse. And then let's say the patient's mother used to drink alcohol, and you would score a 1 in there. There was no family history of drug abuse or illegal substances. Let's say the patient does not drink alcohol, and let's say the age of the patient is 75, so then this doesn't apply to him. And there's no history of pre-adolescent sexual abuse. And there's no history of depression. As you can see, the numbers change based on the criteria, and the appropriate numbers will come up. And then at the end, all you need to do is add up all the numbers, and then if he's a male patient, of course, you have to choose this side for a male patient. And then this is for family history, so it could be either female or male. Add up all the numbers, and this gives you a score. A score of less than 3 is low risk, and a score Up to 7 is intermediate risk, more than 7 is high risk. So you would want to think twice before you prescribe a controlled substance. So the next thing we need to do is we need to do a PMP aware on the patient. So we start by copying the patient's name by highlighting it, right click, and then copy. And then we're going to click on Nevada PMP, login. And then go to menu and patient request. And then plug in the name. And then this is the first name, this is the family name. By doing that, you have less errors. And then make sure that there are no spaces after the name and the last name. And the next thing we need is the patient's date of birth, which we can also find in here. And go back there and paste it here. And basically that's all we need to do a PMP. And then you just go scroll down and click on I agree and search. And of course we're not going to find him because he's a test patient. So that satisfies the criteria of the PMP aware. So the next thing we need to do is we need to click on the forms that were needed for the controlled substance prescription. We can find them in here by going to the hamburger sign and then click on print forms and type CS, and all the templates that you need are over there. So in here we need to have the informed consent, and then this is informed consent. You can print it, and you also need the controlled substance agreement, but this is required more for patients in whom you're going to prescribe the prescription for more than 14 days. So the checklist, we already filled it by using those forms, and the opioid risk tool, we already did that by using the forms that we did, but you can print them and do them manually here if you wanted to. So now that we've completed all the requirements, we can go ahead and prescribe the medication. We needed to do one more thing, which is do the drug screen. And then, so you're gonna, I usually use a drug abuse panel, the one with cocaine and alcohol. And that way we have completed all the requirements and we can go ahead and prescribe the controlled substance. And this concludes today's session. Thank you very much for watching.